Language. It's how we communicate our ideas and our dreams. It's how language disparities are eliminated. It's how we express ourselves and forge relationships. Translation and Interpretation Network ensures language is never a barrier for communication. 10 trainings are designed to create professional, highly qualified interpreters and translators who become the bridge for doctors, nurses, teachers, social workers, judges, lawyers, business owners, and the people they provide services to.
As a full-service language company, TIN has numerous opportunities to serve you, from on-site interpretation to scheduled video or phone as well as on demand, all offered in 200+ languages, including American Sign Language, to document translation, voiceover, subtitles, transcription, card, and unlimited training opportunities for you and your staff. One thing I'd like to share about TIN that's very near and dear to my heart is the fact that we have been a part of our community since 1999, and ever since, we have worked on empowering its members through various opportunities, providing jobs to immigrants and refugees, and helping to end poverty with a living wage, which we can all agree is crucial. Our continuous effort to support the community and end language disparities is what drives us and our partners on a daily basis. As an immigrant myself, I'd encourage anyone who speaks a second or third or fourth language to take advantage of receiving training and taking a stand in ending language disparities. The reward of helping your fellow community member is priceless, and the impact we have in children, parents, patients, and other staff's lives is beyond words. TIN is very excited to sponsor the panel about the meaningful access to healthcare for all, and can't wait to hear the panelists discussing the issues facing interpreter trainers as the performance level certification becomes available to interpreters of all languages, thanks to the ETOE English to English interpreting exam. Thank you.
I am now pleased to introduce Mateo Rutherford, Chair of CCHI and the Technology and Systems Manager for Interpreting Services at UCSF Health. Mateo?
Hi, everybody. Welcome. And thank you so much, Jorge, for your introduction. And we have a wonderful panel here today of managers of language access at large healthcare institutions across the US. But before we get started, I just wanted to do a huge shout out to everyone on the West Coast who has given up their Saturday morning. But in particular, I noticed that somebody has joined us from Taiwan. And if the app on my phone is correct, it is 2:30 in the morning in Taiwan. So that's huge dedication, a huge shout out for them. And we have another person in Pakistan, and I believe it is 11:30 at night in Pakistan. So stay with us, don't fall asleep, drink some coffee. So what I'd like to do is ask our panelists to go ahead and introduce themselves. And I'm going to ask them if they could tell us where they are, what city they're located in, and what institution, and tell us a little bit about your language access services at your institution. What are your staff languages? What other languages are in high demand in your particular area? And how many more or less of your interpreters are CORE or CHI certified? So let's start, since it's cloudy and rainy here in the Bay Area. I'm thinking about the sun, so let's follow the sun and start in the east with Alegna, and then move west to Valerie, and then to Idly.
Hi, good afternoon, everyone. My name is Alegna Zavatti. I am the Director of Interpreter Services at Boston Medical Center. Boston Medical Center is a 487-bed academic center. We are affiliated to Boston University. We are the largest safety net hospital in New England, also the largest and busiest provider of emergency services in the New England area. And interpreter services, if it's not the oldest, it is one of the oldest interpreter services department in New England. Our current population of patients that speak a language different than English is 28%. 50% of our patient population speaks Spanish. And internally, we have staff to support 14 languages. Our languages are Spanish, Haitian Creole, Portuguese, Cape Verdean Creole, Vietnamese, Arabic, Albanian, Amharic, Tigrinya, Somali, French, Mandarin, Cantonese, in addition to ASL and CDI. With our team of interpreters, we're able to support 95% of our patient population, the languages that our patient speaks. And then we have a really wide composition of other languages of lesser request, which is that other 5%. But just to give you an idea, in fiscal year 2022, we used 167 languages out of 250 languages that our phone and video vendor offers. And combined in-person phone and video interpretation in 2022, we completed close to 700,000 encounters. In terms of how many of our interpreters are certified, I would say around 10% are either CoreCHI, CHIs, or CMS.
And Alegna, does that include your staff and vendor interpreters?
So we don't use vendor interpreters. The only vendor interpreters that we have are for ASL and CBI. We work with the Mass Commission for the Deaf and Hard of Hearing. And then we have a other group of vendors that do support with our needs for ASL, CBI. But for the other languages, it's our staff, phone and video interpretation.
Thank you. Wow, impressive operations there. And Valerie.
Hi, I'm Valerie.
Ohio.
Yes, Columbus, Ohio. Hi, I'm Valerie, Language Services Manager at Nationwide Children's. We are second largest pediatric hospital in United States, over 650 beds. We staff interpreter to support top 4 high demand languages, Spanish, Somali, Nepali, and Arabic, respectively. We have 7-8 languages service vendors that also support providing language services for annually we serve over 100 languages. In 2020, we deployed staff call centers. So staff interpreters now are highly skilled in managing in-person, phone, and video interpreting assignments. National certification is part of our job requirement at Nationwide Children's for staff interpreter. We revise our job descriptions and update the hiring and onboarding process so we can carefully consider and plan our future workforce. Composition of our team, of course, we need a scheduling team who oversees the interpreter scheduling operations. We still do combination of in-person and remote. We have 17 staff interpreters who hold CCHI certifications. They are no supply Spanish interpreter and myself certified in CCHI Mandarin. We have 5 core CCHIs and we are still hiring more staff interpreters. I think that I cover all about our team. Back to you.
All right, so all of you with CHI certification, you heard it, Columbus, Ohio, they need interpreters. Thank you so much, Valerie. Idly, let's move over to Minnesota.
Great, thank you. Well, from what I see on the poll, we have a lot of people joining from the Midwest. So I'm not going to spend a whole lot of time talking about the system that I work for, but I represent M Health Fairview today here. And we provide services on an average for over 150 languages on a yearly basis. So we are a true melting pot here in Minnesota with the languages that we see. We staff internally at Fairview for 9 languages currently, and we have 47 staff interpreters to include sign language, Amharic, Cambodian, Hmong, Karen, Laotian, Russian, Somali, Spanish, and Vietnamese. Certainly some of the high demand languages that we see here are Somali, Karen, Spanish, and we can go on with the list, but certainly those are our top volume languages. We provide a hybrid modality services, just like Valerie was saying. During the last few years, we transitioned and opened about a year ago our language services hub, our language access hub, where our interpreters are able to provide remote services, phone and video from that central location. And I'm very blessed to have a large team of staff. We also have our patient services coordinators, also known as schedulers, that do a phenomenal job coordinating services. And we have a robust team of leadership team that oversees the operations of about, we average about 1,250 sessions on a daily basis. And that's including our own staff and also the vendor support that help us cover the need. And just like Valerie was saying, we do have certification in some of our job descriptions, not all of them, to be able to encourage those that have not been certified to take the leap and become certified. And the launch of this new credential is making that possible, because now a certification will be available for all languages in all components. So I'm happy to be here and join the conversation. I think forgot to mention that from our team, 62% of them are certified.
Wow.
So that's more than half, and getting closer to having a full body of certified interpreters. Thank you.
That is wonderful. What an amazing team we have here. Lots of experience, lots of languages, and covering at least half of the United States. I thought the Bay Area was diverse, but obviously the entire country is extremely diverse. So the next question I'd like to ask you all to think about is, for you as a manager of language services in obviously large hospitals with a very diverse population, what makes this new performance-based certification for all languages so exciting for you as a manager? And let's go ahead and start in the middle with Valerie.
On a personal level, I am most excited about collaborating and working towards something like huge, a common goal. Being part of groups, working our best to evolve our standard of professionalism in healthcare interpreting. This is really rewarding for me at a personal level again. Also, certification shows a person who has a specific knowledge or skills needed to do a job. So CoreCHI require written exam. Now with the performance level certification become available for interpreter of all 8 languages. It really ensures that all staff interpreters are held to the same standards for all domains of knowledge and skills necessary to perform their job. So when we value credentialing and the future of the healthcare interpreting professions, the demand of hiring skilled certified healthcare interpreter will grow. So that's my belief. And then as a staff, we have a staff that who all require certification. This is really something for me that I'm very excited about. I definitely have more work to do to work with our staff to pursue CoreCHI performance. Back to you, Mateo.
Idly, let's go to you. In Minnesota, what makes this new certification so exciting for you?
I think it's exciting because it really allows us an opportunity to do things differently in the language access industry. So it really is kind of bringing us to a different level of what our patients deserve, and also our interpreters in terms of recognition and credentials. I think it provides that equity aspect that we are missing for all this time, to make sure that all languages have the same access to testing, and they're able to show that they have earned the highest credential in the U.S. It really challenges everyone, in my opinion, and this is kind of why I get excited. It's a challenge, right? It's an opportunity to be able to, regardless of my language, take that next step and be able to prove the world, right, that I'm able to be a national certified interpreter. I think there's been a lot of interpreters that have been waiting for this time to be able to do that. And so I'm very excited about that, because I feel like as leaders, we're here to support them and we can help them get there. I think it's the time to show the world, right, that everyone can be and should be certified. And this is the way we can advocate for better quality. For me, it really is all about patient care, right? We are here to provide a service, and the service can be met if we have quality services. Our patients deserve that. And I think that we can do it now with this credential. I also feel like it really is, I think a lot of our hospitals are working on diversity, equity, and inclusion, right? There's so many areas of our systems that are looking, what can we do to build equity in our services? And if you think about our services in language access, they really reach the entire spectrum of services, from the time a patient is admitted all the way to the time they end up going home. And even if they're going home with treatment, right, there's still services provided to them at home. So with that, I feel like this is the time to advocate for equity and the provision of language services. And I'm saying provision of certain language services that are certified and that we know that they have gone through a program that has been vetted their credentials. So I think the time is here, and the time is for us to bring equity in all languages by having all of our interpreters be certified. Thank you.
I love that. I love both you and Valerie mentioned that everyone's going to be on equal footing now in terms of the patients receiving the language services and in terms of the interpreters providing those. Alegna, would you like to add anything from Boston?
I can add anything to what Valerie and Idaly just said. I agree wholeheartedly with what they just said. On a personal level, I can share that I became a nationally certified interpreter 10 years ago. It wasn't a mandatory requirement. It's not a mandatory requirement in Massachusetts, but I saw it as an opportunity to further advance my career. And I have kept the certification because its certification forces me to know what's going on in my profession. What are the changes that are taking place? Because I need to accrue the CEUs, then I have to go to webinars and participate in conferences, and I have to be involved. And I think that is a really good benefit that the certification brings. I don't think we need to wait for it to be mandatory. I think it's also something that we can do, on our own, just because we want to be the best at what we do.
All right, thank you. A follow-up question: what challenges do you see for your current CoreCHI interpreters to obtain the full performance-based certification? And what, more importantly, perhaps, what solutions do you see to those problems? And I'm just going to open up the mic.
For me, one of the challenges that I see right now is that I have some staff interpreters that can speak 2 languages. And so there's this question of, do I need to get 2 separate certifications, right? If I speak Cantonese and Mandarin and I already have my Mandarin certification, you want me to go through this whole process for Cantonese as well? And what does that entail for that interpreter or for those groups of interpreters that speak 2 languages? I think I saw someone on the chat that speaks like 3 or 4 languages. So that is something that I need to think about, like, how do we do this in a way that it's not perceived as a burden on the interpreter or the employee either.
That is a great point. And there was actually a question about that in the chat earlier. And so I'm hoping that we can address that later in the summit today to kind of clear up how that's going to work with the new CoreCHI performance certification. Valerie and Idaly, what challenges and solutions do you see?
I can start, maybe Idaly. So I think I have a small group of CoreCHI, but definitely not everybody is big fan of taking exam. I think a lot of staff probably will have some anxiety of preparing the exam. So that's probably the biggest challenge. I think as a manager, we can definitely support our staff to help them go through the process, provide some support within protecting time for them to prepare, embedding some of the training that support your staff go through this process. So I think that that definitely will reduce some test anxiety rather than just tell them that go take the exam because it's required. So set the plan with your staff. Just like as a manager, we set up a development opportunity plan for them. So work with your staff individually. Everybody learn differently. Everybody will perceive this type of certification exam in a different perspective. So personally, I would definitely go through that process with my individual staff to support them throughout the whole process.
Great. Awesome.
I think, Mateo, that I second Alegna's and Valerie's perspective as well. But I think that no challenge is big enough. If we have overcome what we have gone through the last 2-3 years in terms of transformation in the delivery of our services, we can do anything, right? You set your mind and you can achieve it. So just like all of our language services programs and interpreter service programs have adapted to like what we experienced with the pandemic, and we continue to do so, I think we can also work through this and support our teams, right? And be able to have plans, develop plans, establish, goals and targets. I think that over here at mHealth Fairview, we're very lucky because the leaders and managers that oversee our interpreters, they also have first experience being interpreters themselves. Some of them are still active and current practicing interpreters. And so that gives them first, again, that experience to be able to help them see what the interpreter will need to be able to be supported better. We also are very lucky that we have excellent educational benefits for our interpreters, where they can get paid training and paid time for CEUs. And so if there's specific areas that perhaps they need to work on, they can utilize some of those employee benefits to, do what they need to do, right? And so I'm very, very excited about that. And I think that, again, if we work together and we support interpreters, and also as leaders, what else we can do, not just for our own team. In our case, we have a large volume that is supported by vendor services. So also kind of thinking what else can we do to help the other interpreters that are not staff, that perhaps have no access to resources to get training and such.
Great point. Great point. And that leads us to our next question. But I wanted to really point out something here, that this is a very unique panel, maybe not as unique now as in the past, but you notice that all of our managers on this panel are also interpreters, certified interpreters. And I think that is becoming more common. And I think that's a really positive move in our profession, because I think in the past, interpreting services were just kind of under somebody who was just a manager of another department. And so I think that's a real positive step forward that we should acknowledge here. So Idle, you brought up the question of vendors, and as Johanna so eloquently put in her speech, is that we really need to lift all boats in this profession, and we as managers know how much we depend on vendor services, to supply us with those 167 languages that we need each year, when our staff can only support maybe 20 languages or less. So thinking about that, given that certification establishes a quality guarantee, what suggestions do you have to help promote CoreCHI performance certification among our vendors and among freelancers in general?
I think it's, again, there's a call for action, right? To be able to think internally what we can do. I think that, again, it's a challenge and an opportunity. We should challenge all interpreters, regardless of who they work for or where they work, right, in healthcare. Again, in the end, it's the patient that benefits. I certainly care about our patients at mHealth, but I also care about all patients worldwide, really. Anybody deserves quality care. Doesn't matter who the interpreter is, as long as the interpreter is certified or has quality training, right? So I think that, again, vendors, and we call them language access partners, right? They need to be part of the conversations. We all need to come to the table and see how we can pull resources together and help the interpreters. As I mentioned before, we only cover 9 languages in-house, and we do see 150 plus languages on a yearly basis. So as you can do the math, a lot of our services come from interpreters outside of our network, and that's why it's so important. So I think this just finding ways to together work to incentivize the freelancer interpreters to again find what's getting on the way for them to get certified. Is it cost? Is it training? Is it fear, right? Anxiety? What is it? What is it? So for hospitals and leader administrations is to also talk to your leaders, right? And to your quality partners as well. What can you do? What are the metrics of success that you can put together to make sure that you're working towards achieving this with all of the resources that come to your hospital? I think in the end, vendors also need to put their own piece as well and see that this will be a competitive advantage, right? That will be a key differentiator, because as a purchaser of services, I certainly would like to work with companies that value certification and encourage people to have certification and come to the table and talk to us so we can formulate a plan to help everyone out there get this credential.
Thank you. Thank you. Awesome. Let's jump over to the East Coast. Alegna.
To add to what Idoli is saying, I think vendors need to be part of these conversations as well. They need to be invited to these type of events. I forwarded this invite to all of my vendors, because it's also really important for them to see us outside of that vendor-client relationship that we usually have when we're in a meeting. In here, yes, I am the Director of Interpreter Services at VMC, but I'm also a nationally certified interpreter. And there are things that I can do as a manager to help improve the profession for everyone. For example, what Idoli was talking about, the stats that you can maybe request, or what are your metrics that you want your vendors to meet. It is more and more common for large health systems to have service level agreements with their vendors. And when you are renewing an agreement, you can maybe add something around the quality of the interpretation. In Johanna's presentation, I think someone mentioned that, I don't know if it was Johanna, but someone said, vendors want interpreters to do 40-hour trainings in 2 days, which is virtually impossible. But you can help raise the bar of the interpreters that are working on these language companies by having these service level agreements that, you force them to meet a standard to be able to work with you. And that's a way that we as managers can also help move things along. I think that if we want to raise the bar, and I don't want to put service language vendors or service language access partners as like the evil people, or like, no, we need them, because I wouldn't be able to do what I do without them. But I do think that if we want to raise the bar of our profession, we need to also be part of these conversations. They also need to help us with quality concerns. They need to help us be in a better place so that our profession grows. They need to be here to listen to what interpreters have to say and what managers have to say, and then take this information back to their headquarters and say, there's a shift that's happening. Do we want to be part of the shift? Otherwise, we're not going to be able to reach these very big, ambitious goals. And in 10 years, 5 years from now, we're going to still be having the same conversations. So I think that's, I don't know, that's my 2 cents on the questions.
Great. Thank you so much. Valerie, would you like to add anything to this discussion about supporting vendors and freelance interpreters?
That's a great point has been shared. This is a question I ask myself every day, and then I still don't have answers. Most medical centers, in addition to staff interpreter, we rely on vendors, right? They support us to provide language services. Therefore, any vendors that our organization select significantly impact the overall quality that our language services department offer. Because we got complaints like, oh, this interpreter has some issues, and they sometimes don't know if the staff interpreter or agency interpreter. So it all kind of mixed together. So ideally, a big if all the language service provider can work together to continue to prove that there's a commitment to the professions, knowing that there's a national healthcare interpreter certification that can help boost professional credibility. that will actually show in the healthcare network in general, and it really increase staff confidence and trust in the service they receive. So this is something I think definitely we can reach out to our vendor, provide that. And then some of our language service vendor already offer tier rate schedule based on language. Some of them charge higher than certain language. So I believe that there's definitely a existing system for vendors to consider. They can compensate interpreter based on the certification that interpreter have received. And then they can disseminate the information to all the freelance interpreters that earning national certification can help you advance your career. So definitely there's a lot of opportunity for medical centers to team up with language services and I think training providers that provide support for our talent workforce in general. So I think we will have more in-depth dialogue later this afternoon with our training providers.
That is a great suggestion. And I think as managers of medical center language access services, we also need to step up, and we also maybe need to be willing to pay a little extra for those certified interpreters. And the cost benefit is always so difficult because we know there's a benefit to having a certified interpreter. We know that communication is going to go smoother. It's going to take the provider less time, and they're not going to get delayed in their schedule in the clinics, but it's hard to quantify that. So another suggestion that I thought of is using CCHI. We have the list of certified interpreters on our website. And as managers, we can go onto that list and we can look up the certified interpreters in our service area. And we can reach out to our vendors and say, hey, have you reached out to this interpreter? This interpreter is certified for Somali with CCHI, and I'd like you to contract with them. We would like certified interpreters at our hospital. So that's another very proactive thing we could do as managers. So shifting our focus a little bit now to our daily operations, hiring practices, workforce decisions, policies. What ways do you think that this new performance-based certification will affect the policies and your workforce decisions in your institutions now that this certification is available for all languages? Let's start with Idly over in Minnesota.
So first of all, I think it's good to recognize all the interpreters that are here with us and all those that are certified, and go far beyond and think about those that have been certified all this time, right? Because I think they have been the pioneers and do deserve the recognition because they did it as soon as the certification became available. I personally know several interpreters here in Minnesota that have earned the certification credential in many areas, right? That are certified in the legal area, they're certified as well in healthcare. But let's talk about that question that you said, but I just wanted to acknowledge all the interpreters we have here. And again, give them some kudos and making sure that those CoreCHI that are listening to us are getting on this first wave of the new credential too. But I think that it really, I think as hiring leaders, we really need to kind of see the difference, right? I can probably share different examples of things that I've seen in my career in healthcare as language services and most recently hospital administrator. But I think that it really it speaks a lot to me when you see when you have to experience any sort of surveyor coming to your hospital, like Joint Commission, and coming in and saying and trying to look into, you know, one of your patients that require language assistance, right? And once they pull up the interpreter file and are sitting with our supervisor of the interpreters, and once they see that the interpreter is certified, there's no more questions. They're done with that. So that shows the value added that our credential of National Certified Interpreters from CCHI gives to the daily operations in healthcare, right? So ensures quality, ensures patient safety, ensures customer satisfaction. When you go to, you know, for your own healthcare, you want the best doctor, right? You want the one that has all the credentials. Same thing should be for interpreters. So I think that it really affects that, because we really want to have the interpreters be certified in all languages. I think that we need to think about, again, seeing that as a differentiator in hiring purposes. Like, to me, as a hiring manager or director, I would certainly go for the interpreter that has the certification compared to somebody that doesn't have that. I think it's, again, if we see certification as the path that will take us to the next level, when we can provide those high quality services, and that's how we need to put it in our daily operations. So like Vanessa was saying in some of the comments and others, like, let's ask our vendors, what's the percentage on your roster that is nationally certified? Is there a way that you could make sure that, you know, our first choice will be the certified interpreters, right, for our patient needs? So looking into the daily requests that go to them and ask that. I think that, again, just thinking about some of those experiences that I had dealing with Joint Commission surveyors and finding that value added, I think that needs to speak highly on the daily operations and the delivery of all of our services across all deliveries, because we have to think about beyond on site, right? I think that's another challenge as leaders and as trainers, and I know we're going to listen to the trainers later on, but thinking about in all modalities, because certification is not just for interpreters that come on site, it's for everyone, video and phone. That's what I can share.
Thank you so much. That was a great share. Let's jump over to Boston.
Yeah, so I think we need to start having these conversations. For example, if you in your organization, you don't have a pathway for your interpreters to, let's say, get a promotion if they're not nationally certified. And when they do get the national certification, if that doesn't exist, then that's a pathway that you can create for your staff. We're talking about creating this network or creating this a way for our staff to have better benefits, better, better work conditions as well. So for us, it's not a mandatory requirement, but we have started the conversation with our HR teams, for those interpreters that speak two languages, what does that mean? Our organization does reimburse for CEUs and conferences, but it does not reimburse for certification or for recertification fees. So those come out of pocket. So let's look at, we are also a unionized environment. So what are other union groups doing that have a mandatory certification, and how can we mirror that for our staff as well? What pathways can we create for them? What opportunities are there for growth within our organization? Because you also, as a manager, want your teams to grow, right? You don't want someone doing the same job for 40 years without ever being able to go somewhere. So I think it's important that we open up those spaces. This is not something that I'm going to change tomorrow, right? But just reaching out to whoever is your HR contact person and asking the question. Like, that's the first step and the most difficult step. How can I change this? How can I make things better for my teams? And then maybe going to your vendor and saying the same thing, like, create a pathway for your teams, even if it's more expensive that you send a certified interpreter. We're willing to pay for the services that our ASL, CBI interpreters offer through agencies because they do have mandatory certification. So we need to pay for that. So why can't we offer the same things for our other languages, for our spoken languages? So as Idoli was saying, also, sometimes this national certification can be the decision making, what leads you to choose one candidate over others. Sometimes you have really strong candidates, they do well in the interview. If you have testing in place, they do really well with the testing, and then you have to make a decision. So the certification can be that differentiator, because when Joint Commission comes, then it's easier to show the credentials and there's less questioning around, a certified interpreter. Not saying that the other interpreter is not qualified, but if you have to make a decision, that can be what prompts you to making that decision. And that's also something that as managers, we need to take into account. So the more certified interpreters that we have, you maybe get a higher compensation upon hiring. If you do it if we hire you without the certification and then you get the certification, then you maybe get a higher compensation as well. So I think it's about opening spaces and change take a lot of time, but we have to start somewhere.
And I'm hearing basically this theme that, hospital staff interpreters is the way to go in terms of getting a lot of support towards professionalizing. And it really seems that what I'm hearing is that certification is a huge benefit to getting hired at a hospital, and once you're hired, to getting promotions within the hospital. Valerie, I'd like to ask you to chime in with any additional comments or ideas. And I wanted to ask specifically, all three of you think about, what does your policy say around certification of interpreters? Because you both have mentioned Joint Commission, and I know Joint Commission really looks to hold hospitals accountable to what their policies say.
So I can start with really excited about the CoreCHI performance certification available for language, because that impact our workforce decision and talent management that we need to, as a manager or a service provider managers, to balance the knowledge and performance-based approach, meaning that we may need to create more performance-based training to support staff to continue grow. From a policy perspective, it's for me, it's just, again, it's a matter of fairness that every staff member that need to have the same process, written and performance-based. So I can share a little bit our experience that in 2017, we actually was able to join a trend with a significant number of hospital language services, adding CCHI certification to our job descriptions. So we were able to, I was very, very lucky to receive support from HR because I think I was able to preach the choir that in many cases, it really boosts employee retention rate, engagement, and we are also adding this CCHI certification to our hospital credentialing management system. So we are sharing the same system with all the nursing, APN, and everyone. So it's a valuable process that improve. I also remember our staff interpreter who worked together prepare the exam that it's a very and highly anxiety that you need to take both exam, but also they remind themselves that, hey, we are actually heading to a professionalism. That also improve their professional confidence. Also very important, that's how I personally experience, is that now with staff interpreter required to participate in the certification program, we also communicate that the importance of they really need to make time for ongoing learning, because they need to make sure they submit their 32 CE every 4 years. So we're able to provide evidence that this is a regular competency assessment. And then all my colleagues mentioned Joint Commission, and I was happy to share that during our most recent Joint Commission survey, they look at our competency assessment for interpreters, and then we are able to prove that our interpreter has a competency, they check off, and then they go through their CE process, and we're able to share them that we have a credentialing management system that can prove that interpreter are all certified and continue to engage in professional development. So however, I think by having this CoreCHI performance adding to a job requirement, it does take some time. I'm doing some math. Like it would take a few testing windows to really future-proof our workforce. Like I'm now thinking about, now I have to update my policy. Now it's gonna increase maybe a little bit obstacle for me to hire candidate for my team, because now with that balance of requirement. So this is again by that I'm looking at it more like ecosystems that we have peers that actually, like everybody today, we have 566 that actively engage a professional development. And then we are actually here together to prove that we are engaged in a trend and effort to raising the practice standards. So kudos to all of you all. Thank you.
Awesome. Thank you. Thank you, all three of you. Those were great interventions. And you, all three of you mentioned also working with HR. And we had an interesting experience at UCSF. You know, we added national certification to our job description. And so at first we would hire interpreters. If they weren't certified, they had 6 months to get certified. And I realized now that's too short. You do need maybe to a couple more testing windows to allow people to prepare and get certified. So that's a really important point, is allowing that time and space for people to get certified. Now, however, our HR department will not even send us a resume if there isn't national certification on it. So we don't even see candidates that don't have national certification. So something to think about in the future. I wanted to kind of shift gears a little bit here and just open up the mic and ask if there are any other suggestions you have for your manager colleagues to help promote the new CoreCHI-P performance certification. Any tips or tricks that you'd like to throw out there?
This is Idly. I wanted to just share a little bit of what we've been doing. And the last few years, my team has been working very hard on developing a educational, almost like a bundle of benefits for our staff in terms of, reimbursement for certification. This year, we actually instituted a renewal reimbursement as well. So we reimburse for certification and also for the renewals. And I think we need to think about certification as a tool that we can use also for succession planning. I think that we saw a lot of interpreters that exited our field in the last few years for a number of reasons, and we haven't been able to attract a whole lot of new talent. So we here at mHealthcare, we are doing a lot of innovation to try to figure out how we can find and get interpreters. And this is a sales pitch, but I also have a lot of open positions. I have 10 open positions. So come and join us if you are in Minnesota. Please apply. We need interpreters. And if you're certified, even better. And if you're not, get certified. But what I'm trying to say is really, try to look and just challenge yourself and figure out what can you do to help the interpreters understand the value of the credential. Again, knowing that we have a lot of our pioneer interpreters here that were certified a long time ago. A lot of them did it because of, for pride, right? To show their credentials, because I think there's a lot of us that in our cultures, education is very important, right? So we want to show the world that we have pursued the highest credential. I think there's other groups of people that need a little bit more motivation, right, to get that credential. So what's getting on the way to get that? So maybe is it again cost? So maybe pay incentives. Here at mHealth Fairview, we have developed different job descriptions. So just like some people were sharing in the chat, we have level 1 and level 2. Level 1 are those interpreters that are not certified. Level 2 is interpreters that are certified. So it's a different pay grade, and certainly they get paid more because they're certified. And that has helped. But we still have, again, a percentage that has not gotten certified. So we need to continue working and seeing what else could they utilize for that. But I think maybe getting together with some of the associations, professional associations of interpreters locally and regionally to see, what others are doing to get interpreters motivated. Is it providing, webinars or sessions or training, collaborating, maybe again, scholarships. I know that here in Minnesota, there's been scholarships in the past offered by the organization. So maybe it's coming together and promoting some of those, getting the word out there that that's a resource that's available. Those are some of the tips that I can think of and kind of sharing what we're done. But I think in the last few years, we've been working really hard to have resources available. So now we can offer that to staff and say, you can use all of this to help you get that credential.
Thank you so much, Idly. We have a few minutes left. Valerie, Alegna, would you like to add anything?
Just quickly, I remember I did some literature review recently. I read some data about on average, 75% healthcare workforce are certified and licensed professionals. So now as certified healthcare profession, I'm so proud of that now our interpreter are part of that 75. Maybe we added more, like all the healthcare provider are 80% are certified. So I think this is something that definitely show our interpreter that earning a certification is really help us to remind ourselves we have achieved level of competency that qualify us as a certified healthcare workforce. So definitely, I think I mentioned earlier that as a manager, we can support our staff, but also educate our employer on the value of CCHI certification if you haven't been able to do it. Today, you guys get a lot of resources. This is time to collect this positive research findings, success story from others, medical centers, CHI holders, that you can bring all this package to your C-suite and then present to your leadership. Oh, I don't know if we mentioned that we have a national language access leadership huddle facilitated by CCHI that provide a great volume that definitely everyone can expand. I think we have 10% supervisor manager today here. So definitely join the huddle, and that will expand your professional network and then to allow you to have some resource and sharing. Again, I just keep thinking about the exam anxiety that we just want to be mindful that individual may have different financially situation. As a manager, we want to try our best to support them and also help them to reduce that exam anxiety to help them go through that whole process. I think that's what I have. And I hope not only I'm inspired that, but every one of you are motivated to take action with your team.
Thank you so much. Thanks for the plug for the National Language Access Leadership Huddle. And I'm going to ask Natalia and the support team, if you could go ahead and put in the chat how managers, supervisors, and directors can access or sign up for that huddle. And I'll put in another plug for that in a minute. But first of all, any last words, Alegna?
The only other thing that I would like to say is I agree with what Valerie said about, there's a lot of other professions within a hospital system that do have a certification. And I think by talking to our C-suites and making them understand the value that we bring, it's more of a value proposition sometimes because they see it as an expense because we're not a reimbursed service, but we also want to provide the best quality. It is aligned with a lot of our hospitals' diversity, equity, and inclusion views and values. So, we need to really make sure that we're positioning ourselves, that we're encouraging our interpreter, that we're talking to our interpreters. What are the barriers that you see? How can we help you? Here are the resources that that are available out there. And I don't know. That's I think it's a long way, but I think we can do it together. And I encourage you to look for the information that's out there. And it's been a pleasure to be here today.
Thank you so much. It's been a pleasure to speak with all of you today. As you can see, some of our commissioners are managers at healthcare institutions, managers of interpreting services. So I do want to plug one more time CCHI, because of this and because we wanted to give a voice for managers and supervisors to be able to share best practices. We have created the National Language Access Leadership Huddle, and we meet quarterly. Our next meeting will be April 14th, and please join us. The information is going to be in the chat, and it'll give us the opportunity to dive a little bit deeper into these topics and other topics in the future. And idly, one of the participants wants you to move to Texas, so you could consider that if your family is amenable to that idea. And I just wanted to plug one more thing. I think it's really important. One of our commissioners the other night when we were doing a practice session, Andrea from Atlanta mentioned this idea of hallway education. And we know we are constantly trying to educate providers about the importance of professional interpreters for language access. So I just want to plug this idea that we all add when we're doing our pre-session or our introduction that I am a national certified healthcare interpreter. So I always introduce myself. Hi, I'm Mateo, your Spanish interpreter. Now I'm going to introduce myself as I am Mateo, your nationally certified Spanish interpreter. Thank you. I'm going to pass the mic to Jorge for questions and answers.
Awesome, Mateo. Thank you so much. Idly, Alegna, Valerie, incredible insight that you all provided. Again, I'm trying to keep up with the chat, but it's a little difficult because there's just so many comments. But after during the break, you'll want to take a look at the chat. There's just some great feedback for you all, some additional things to ponder. So thank you all so much. So we've got several questions that I'd like to cover, and we've got a short time to cover those. So I'm going to dive in. The first question, and something that I think is really burning on a lot of folks' minds, is how the CoreCHI-P credential relates to ASL interpreters. Could you speak to how they were involved in the development of the ETE exam?
I am muted again. I am so sorry. Yeah, so there were ASL interpreters who served as subject matter experts in advising on the exam. And it is available for ASL interpreters. We do think it's important that ASL interpreters who are working in the medical setting get the CoreCHI performance exam because it is specific to medical interpreting, to healthcare interpreting. However, it does not replace in any way the ASL interpreting certificates that exist. RID, BEI are the ones that come to mind right now. And in fact, we are requiring one of those ASL interpreting certifications as proof of language competency. So great question. It definitely, for the ASL colleagues, I think it will be a feather in your cap.
Awesome. The next question, Mateo, who do you count as potential allies to language services managers within a healthcare organization, allies that can help to promote interpreter certification in general and the performance certification more specifically?
So I'll answer and then I'll open the mic up to my colleagues, but you know, HR was mentioned a lot, and I love this idea that Valerie presented of having the same management system in your hospital that manages certification for nurses, for physicians, for social workers, et cetera, manage your interpreter certifications also, because that puts us on an equal footing. It makes us look like we are equal professionals with our nursing colleagues, our physician colleagues, et cetera. That is just a fantabulous take to the bank suggestion. Another suggestion is, I know that like nursing administration offices, I know a lot of places would like to have the magnet designation, which, similar to Joint Commission, they're going to look at certifications. They're going to want to make sure everybody that can be certified is certified. And so showing when you're applying for magnet or you're reapplying for your magnet certification, if you already have it, showing that your medical interpreters are also certified, I think that would definitely be a plus for your application. As Idly so well put it, it would be a differentiator in your application. Anything else from Alegna, Valerie, or Idly you'd like to add as in terms of allies?
I want to echo what you mentioned, and Valerie, we do that over here at Health Fairview as well. So HR manages all of our certifications. There's also a state roster that's required for healthcare interpreters that the HR manages as well. And it kind of relieves the leader as well, because HR manages that and HR, requires that. And, if you don't have it, you can't work basically. So again, it puts us on the same equal footage. I think from our perspective here, some of our best partners have been equity and inclusion. We have a brand new department at Fairview that is working on diversity, equity, and inclusion. And so we're really tapping into that quality aspect and equity and how that comes together. So for me, that equity has been a great partner.
Absolutely.
So for our group, in addition to Magnan, because that's more for nursing, I did work with our quality improvement department, who actually is responsible for Joint Commission. So it's very similar concept that we want to make sure that our Joint Commission, that when it comes to look at the competency and then quality improvement department, they really look at this very seriously. So they were part of my ally that to help us like improve the overall competency of our like staff. So definitely that language services staff now are part of credentialing staff. And then so now Joint Commission will actually definitely look at that. So I think that's one of the I think is very helpful. Another, it's related to HR. It's like I was able to put together mandatory training for all the leaders and our hospital managers that they need to complete the training for working with interpreter. And part of the module also including introduce about the qualification of interpreter. Now all the staff interpreter are certified interpreter. So that also help elevate that the staff engagement and understanding how important it is to be certified as a healthcare interpreter. So they are my ally. So I hope that helps.
Yeah, we have similar allies, but I would also add to the list that to reach out to those community colleges or agencies that are offering training in different languages so that they are aware that this currently exists and that they can also help us disseminate the information that way through their students so that they finish their trainings, that they know that there's a national certification now available for all of the languages that they're covering. So that's kind of something extra that we are doing as well. You know, we sometimes have people that come shadow our interpreters. So just reaching out and letting them know, hey, this is new, come to the summit or go to the website, watch the webinar recording. I think that is also really important.
Awesome.
Jorge, if I could just do a follow-up on that. I think Alegna really also hit the nail on the head with CCHI is a huge ally for us. And somebody mentioned earlier, I believe it was Idly, the issue we're having with talent acquisition. You know, it was really difficult for us to find talented interpreters for our last couple of hires. And so reaching out to CCHI, going onto the website, finding out who are the certified interpreters for the languages you need in your area, and reach out to them directly. Say, hey, we're hiring. We need you. Please apply. So that's why we're here. Use us.
Yep.
Use CCHI.
That's awesome, Mateo. So going to the registry of certified interpreters and looking through that, that's a great tip. And that actually kind of goes to the next question. And I won't put any of you on the spot, although one of your healthcare organizations is actually mentioned in this question. Would managers from other hospitals ever consider hiring certified virtual interpreters from out of state? For example, BMC hiring a certified Spanish interpreter in Texas. What are your thoughts on that?
So that is currently in what I call my parking lot, because it is something that we've been thinking about. We see three main challenges with recruiting. We just like Idly said, we've had a lot of issues recruiting staff. And the three main issues are, one, that candidates are not passing the assessments. Number two, that they only want to work remotely. And number three, sometimes that the compensation is not enough. Those are the three key issues that we've identified. For the working remotely, we currently do a hybrid model. So our staff works some days in person and some days in our own platform for video and phone interpretation. We had to transition, just like many other hospitals. Up until March 2020, all of our operations were in person. And then we built a house in the middle of a hurricane, and we did the best that we could. so that we could all be on the other side of the hurricane that's still kind of going, but it's not as strong. The winds are not as strong as in March 2020, let's say. So we already asked, because we're a unionized environment, what does this entail? Can we do this? We have a lot of candidates that are from other states. We participated in a virtual job fair. And although we specified that this had an in-person component, I would say 90% of the people who came to our virtual booth were just looking for remote work. So it is currently in our parking lot because I don't know if I open that position up internally, I have to offer it to my staff because of seniority. And then what if I end up with a bigger gap than what I currently have? So that's the challenge, where that's where I am right now. And so it's in the parking lot. I mean, I can let you all know if we change our minds, but definitely it is something that we're considering.
Very similar at UCSF. We are in a hybrid mode, and a lot of our interpreters would love to work 100% at home, because a lot of the benefits that Johanna mentioned in her speech is that, there are a lot of benefits. In the Bay Area, traffic is horrendous. You can end up being 2 hours on the road to get to and from work. So we would absolutely have to offer that to our staff first if we decided to open up 100% remote positions. But we do need some in-person coverage. However, if our vendors could offer us priority picking for certified interpreters remotely, that would be awesome. And I think that would definitely be worth a discussion of increased compensation.
Awesome. Well, thank you so much for a very insightful discussion. Just looking at the demographics of the folks that have joined us today, obviously a large portion of them are working interpreters, and it's just really great to hear your perspective as language services leaders to help them really understand the power of certification and the importance of it. So thank you all so much for sharing your thoughts with us.